Hello and welcome back. So in this lesson, we will review 16 myths about weight loss surgery. Let's put some facts around those stories you've heard. Myth number one of the biggest myths about weight loss surgery is that it's the easy way out. The fact is, bariatric surgery is not the easy way out, it is the only way out. You will have to get extensive testing, you have to fight the insurance company, sometimes you have to fight your friends and family members, you have to go through risky surgery, and you have to change your lifestyle permanently. It's definitely not the easy way out. Myth number two, bariatric surgery is only for people who are extremely overweight. The fact is, the ASMBS, our society, our new guidelines recommend bariatric surgery to be considered for suitable individuals with class 1 obesity, which is a BMI above 30. If the non-surgical methods are not effective. If you have medical problems like diabetes or hypertension, you should really consider bariatric surgery. Myth number three, bariatric surgery is a cosmetic procedure. Not true. It's a medical procedure that can improve or even cure many obesity-related health conditions, such as type 2 diabetes, high blood pressure, sleep apnea, and joint pain. Myth number four, this type of surgery is only for women. Here's the truth. Yes, women tend to undergo bariatric surgery more often than men. Still, bariatric surgery is not exclusive to one gender. In fact, men can benefit just as much as women from bariatric surgery in terms of weight loss and improved health outcomes. Myth number five, bariatric surgery leads to malnutrition and vitamin deficiencies. Now, while bariatric surgery can lead to malnutrition and vitamin deficiencies, those complications are rare and can be prevented by following a healthy, balanced diet and taking recommended supplements. Myth number six, it's a new and experimental procedure. The fact is, bariatric surgery has been performed for over 50 years and is a well-established treatment option for obesity. Myth number seven, bariatric surgery has a painful and lengthy recovery process. Recovery time will vary for each patient. However, most patients experience minimal pain and can return to normal activities within a couple of weeks. Myth number eight, you'll never be hungry. So you might not feel hungry for a year or two after the surgery, but your hunger will come back. But then a small meal will satisfy that hunger. Myth number nine, you can't eat for the rest of your life. This one is even crazier than the previous myth. But that's not the case. Basically, for the first few months after surgery, you won't eat much. And in the long run, you will miss those days. And a couple of years after surgery, many enjoy eating more than they did before the surgery. You will appreciate and savor your food more because you won't be so concerned about consuming huge amounts. Okay, we're at number 10. You have to pay for weight loss surgery 100% out of pocket. Simply untrue. Most insurance companies, including Medicare, do cover bariatric surgery. Myth number 11, you'll never regain your weight. We have to come to terms that obesity is a disease, and bariatric surgery will treat that disease. However, preventing the disease from happening again is up to you. Many people will gain some or even all of the weight back, so the lifestyle changes that we discussed earlier are essential. Myth number 12, you can't get pregnant after weight loss surgery. Nope. This surgery will actually improve your chances of getting pregnant, and the pregnancy will be healthier than before surgery. Even so, please remember that you cannot get pregnant the first year and a half after your surgery. That's super important to bear in mind. Myth number 13, weight loss surgery is very risky. All surgeries have some risks. That said, the risk of obesity is much higher than the risk of bariatric surgery, meaning having the surgery is the safer option than not having it. Bariatric surgery is safer than many common surgeries like gallbladder removal or knee replacement surgery. However, having a positive mindset is vital. It's often said that the biggest rewards often come from the biggest risks. Nonetheless, taking risks opens you up to new challenges and opportunities. Alright, we're almost done. Let's review myth number 14. You will have dumping for the rest of your life. Dumping syndrome occurs when you eat something high in sugar or fat. However, it only happens to about 30 to 40% of gastric bypass patients. The symptoms include lightheadedness, sweating, nausea, abdominal cramps, and diarrhea. This can be a lifelong problem in only a small percentage of patients, and most patients who experience dumping syndrome see a decrease in the severity of symptoms over time. And to avoid this problem altogether, simply consume foods or beverages with less than 15 grams of sugar per serving. Myth number 15. Weight loss medications are replacement for weight loss surgery. So, before we go into the debate of meds versus surgery, remember that the first line of defense is to treat obesity with healthy eating, physical activity, and behavior modifications, right? Still, some folks try this to no avail. So medications are a great option and can help you lose up to 10% of your weight. So it's definitely worth trying. But be aware when medications are stopped, weight regain is expected. On the other hand, weight loss surgery will help you lose more than 30% of your weight and has many other benefits, like reducing the risk of multiple cancers, heart disease, and reducing medication usage for conditions such as high blood pressure, type 2 diabetes, and high cholesterol. So weight loss medications are a great treatment option for lower BMI patients, but they are not as effective nor a replacement for bariatric surgery for higher BMI patients. Finally, myth number 16, you will be happy after your surgery. My friend, happiness begins by accepting who you are on the inside. This is a powerful act of self-love and the first step towards true joy. You are beautiful the way you are, and you should love yourself unconditionally, just the way you are. The time to be happy is now. Do not postpone happiness, because now is the only thing we have, so enjoy it the best way you can. Celebrate your progress, be kind to yourself, and never forget that you are worthy of love, respect, and happiness just the way you are. Promise me that, won't you? Okay, that was a lot to take in, so when you're ready, I'll find you in our next lesson.